So, welcome to our Transportation for You webinar. And because we're starting late, I am going to get it started right away. Jill Kelly is with Drive with Confidence. And Jill, could you take it away?
Well, first of all, my last name has changed. It's now Johnston, but that's no worries at all.
Con-
So,
Congratulations.
thank you. I am an occupational therapist and a certified driver rehab specialist. There's not everybody knows that there are medically based driving assessments out there, but that's where I come in. So, as a general rule, my job is to help doctors and families determine if their loved one is safe to drive. We can come up with restrictions, meaning no night driving or only 45 miles an hour, no highway. There's a lot, so it's not a hard yes or no. Sometimes and we can give them a bubble from home, right? And say they're only safe to drive 3 miles from home. So I'm not exactly sure. I mean, I'm going to do my little bit and then I'm happy to answer questions. But most importantly, I want to educate people that Colorado is a self-report state. And what that means is that if you have any medical diagnosis that could affect your driving, I'm going to admit, all right, we got some people still jumping on. If you have a diagnosis that could affect your driving, you are obligated to report that to the state of Colorado. When you do report that, it could be a stroke, it could be that you use oxygen, that you use a walker, that your memory is not very good. There's lots and lots of check boxes. There's all the big ones: stroke, Parkinson's, MS, all those kind of things. Um, but once there we go, we're growing bigger and bigger. Once we submit this DMV form to the DMV with your doctor's signature that you're safe to drive, then you have equal liability with other drivers on the road. Until that form is submitted, you do not have equal liability because you have not followed all the rules of the state of Colorado. So I can get into things more specific. We can do short, we can do long, but I want to make sure everybody else gets a chance as well. Is that good enough, Barb?
That's excellent. Thank you. If everyone would put any questions they have in the chat, we can gather them and ask them as we go along. Well, Orion, if we can move on to you.
Absolutely. Let me see if I can share my content real quick.
While you're doing that, Orion, let me ask a quick question of Jill. What if you have a parent who is in denial about conditions that may pose a threat to others on the road, and we cannot get them to self-disclose?
Fair question. Here, let me put myself back on the screen. Um, the doctor has the ability, sorry, I can't see me, but the doctor has the ability to actually retire the license on their own. You can do it as a family. You can downgrade to a Colorado ID online, and it just asks you multiple times, this is surrendering your license, those kind of things. I just would it depends, like if it's an older person, they're usually a little more receptive to the liability issue, to just say, you know what, Dad, you could get rear-ended, and because you haven't reported your stroke or whatever it may be to the DMV, you can be held liable for something that's not your fault. So there is actually quite a few options. You can report somebody to the DMV, but it's not anonymous. But you can also go online, downgrade, or you can ask if your doctor is willing to sign the forms that will ask the state to surrender his license. Age is not a factor at all. I've worked with 102-year-olds. Mine's all about skill, right? I literally sometimes don't even know how old they are, but it's all about their abilities on the road.
Good morning. Thank you for your time. I represent a company called AirMedCare Network. I'm down here in Southern Colorado. We are basically a very large air medical transport company. So we do all the emergent transports. We do interfacility transports when you're admitted to, let's say, a lower level trauma center. We will fly you. We offer a membership. It's almost like a co-op or membership to consumers, and we'll fly you to the nearest medically equipped facility for your injury or your health trauma situation. I've been with the company for about 2 years. People know us by different brands all over the state. So down here in the San Luis Valley where I'm at, people know us as Guardian Flight, Reach, and Eagle AirMed. Some people might know our airbase up at UC Health. We fly out of those hospitals. So we have a total of 12 air bases here in Colorado. And what we do is we look at a community's need, we assess how many medical air flights there are, and then decide to put in a air base to better serve that community. So we operate in what's known as a golden hour. Essentially, you have an 85% chance of survival if we can get you to the right trauma center within that 1 hour window of time. We're pretty big. We're the 8th largest airline in the country, 320 plus locations in 38 states. Most notably, I've been a member in Colorado because a lot of folks, not the Medicare folks, but a lot of folks are on what's known as a high deductible health plan. And we've seen a big rise in medical carriers, insurance companies, kind of bypassing the No Surprises Act, which is a law passed to essentially protect consumers from balanced billing. What we see historically is right around a 44% initial denial rate across most carriers for air medical flights. And they deem it essentially, they found a couple loopholes to not always have to cover a consumer. Those loopholes are they can deem a flight medically unnecessary, out of network, or not pre-authorized, which is very hard to do, to pre-authorize a flight in an emergency situation. So we are a non-insurance product. Like I said, it's more of a membership, and we protect you from any of the out-of-pocket costs associated with flights. And that is essentially a membership for your whole household. So we found it easier just to cover the whole household, because a lot of American households, roughly about 85% of them, they have non-traditional dependents. You know, they might have, a spouse's mother-in-law, somebody that might not be a classical dependent in the home. And so we found it just easier to cover the whole home. Our membership covers teledoc. So it's a virtual physician. If you want to avoid a clinic, if you're feeling contagious with something, that covers any of the virtual physician stuff. You can get prescriptions written, etc. And I want to kind of hone in on the membership. So it's essentially a contractual guarantee that if you're transported by us anywhere in the country, you will have zero out of pocket. And what's kind of changed in the last decade or so is a lot of health insurance back in the day did not have deductibles. Deductibles are essentially being used to control participation. And the higher the deductible, the less likely a member is wanting to opt into a flight. So we want to basically do this membership. We've been doing it for 45 years all over the country to make sure that it's medical necessity that dictates the flight, not fiscal situation. We have a lot of people in my neck of the woods that are scared to utilize the air medical service just because they understand how astronomical those bills are and their exposure if their insurance didn't cover it. Like I said, we've been in 12 bases all over the state. We're up there in Greeley, La Junta, Boulder. We do a lot of flights out of Pueblo. And it's I can't speak highly. I'm from Iowa originally. I didn't understand the necessity of an air medical program. But when we see how remote we are, how we're essentially in a trauma center desert for some of the more rural folks, this program just makes a lot of sense. And I do want to briefly talk about Medicare Part A and Part B. So I get a lot of people on Medicare that ask me, hey, you know, I have this supplement, that supplement. What's my exposure to a flight bill? Traditionally, what we see, Medicare Part A only, and then there's Part B. So depending on what supplement you have, you can have an exposure point of about 20% coinsurance. 20% of a 5 to 6 figure flight bill can still be quite the fiscal impact. So, like I said, we're a non-insurance membership. We're a huge network. We pride ourselves doing this. We're kind of, our flight crew is going to be on our best day when you're having a really tough time. And one last thing, this doesn't really apply to Medicare folks so much, but when we fly you, if you haven't met your annual deductible for the year, we will cover that in full when we fly you. So that's a really nice, it's almost like gap coverage. And I can't speak highly enough of it. And I appreciate everybody's time and wanted to answer any questions folks might have.
I have a question for you.
Yes.
So would somebody say you were in a horrible traffic accident in a remote area? Would this be something that could be utilized if it was near one of the airports you fly out of?
Yes. So we do. I'm glad you brought that up. So it's not just IFT or interfacility transports. What you just mentioned, that scenario is called a scene call. And we do about 60-40, 60% interfacility transports, 40% scene calls. So there are times where we'll have to, you know, the fire department will close off the highway. We've been known to land in the middle of a highway. I could put a quarter in a cornfield and land there. So the helicopters we use are really lightweight and nimble. And absolutely, we work hand in hand with search and rescue, whether it's off the top of a mountain rescue, car accident, or a simple, hey, you're at a trauma center that's not equipped for your injuries. Either way, we're going to service all those flights. We have a mixture of King airplanes for the high wind conditions, and then our Bell A-Stars, our rotor wing A-Stars for lower wind days. I think that was an excellent question.
So would you have to be a member to have you pick me up if I had that accident in a cornfield? How would someone know I'm a member?
Yeah, so federal law says we can't deny a flight to somebody. I mean, we fly everybody, the underinsured, the non-insured, folks that have various different insurance policies. Frankly, we don't often know if we're flying a member or not. The difference is, as a member, if you wake up in the hospital, your flight in entirety is covered. Does that kind of clarify that? We can't really differentiate who's a member and who's not. We fly all walks of life. The difference is your fiscal exposure as a consumer. Being a member, you have zero out-of-pocket costs.
Wow, that's great.
Yeah.
That's especially good if you have some kind of chronic condition and you're somewhat remote, I would presume.
Yeah, you know, a lot of folks in the city don't think, you know, hey, I live, 6 miles from a Trauma 1 center. Mm-hmm. But I always ask people, are you always there? Do you go down to rural areas for vacation? This is a national program. Do you visit people out of state? We even have international programs. If you're overseas, we can repatriate you and fly you back to the States for recovery. So it's a pretty vast membership with a lot of different options. And, it's really affordable. I've been a member for the last 3 years, and it's roughly $10 a month. And to give my family that peace of mind, I think of it like layers of an onion. You've got your non-emergent transportation, which is critical. You've got emergent, you've got your health insurance, and then we're essentially a membership or supplement to go over that. And if any of those other pieces of the onion fail you, you still have a superseding membership over you to protect you.
Great. Does anyone else have any questions?
Hey, Barbara, it's Todd with MedRide. I have a quick one for Orion.
Yep.
So, Orion, do you guys do non-emergency as well?
Not typically, but we have an issue sometimes. Trauma centers and health clinics, they kind of use us like their Batman phone, right? So they're, as humans, they have empathy, and there's some gray area there. Oftentimes, if somebody's having a hard time, medical trauma, we'll fly them. And that's where it kind of gets the slippery slope, where if a health insurance carrier is starting to argue, hey, that wasn't a medically necessary flight, and they kind of start splitting hairs. So there are instances where our flights are kind of deemed non-emergent, and that's where it can expose the consumer to not being covered. But it's typically based on medical necessity, Todd.
Great info. Thank you.
Yeah, I think this is a really great opportunity because your whole company is non-emergent. I imagine that we do emergent, and the two together, as far as the different availability and assets in the state, is a really great network that's being built to serve the various communities. So
Yeah,
I see
absolutely.
cars everywhere. I'm in the San Luis Valley. Every couple hours, I'll either see the Red Willows, which just got sold to a different company, like to the Golden Manor, and I see a lot of your assets on the highway, the MedRides, and I think it's great.
Good. Well, thank you.
Great. Does anyone else have a question? We can always come back at the end, presuming we have some time. Thank you so much, Orion. I think I need to become a member just in case for traveling purposes.
Yeah.
Thank
Absolutely.
you. And with that, Todd, let's move on to you. Todd Glasser from MedRide and Metro One Ambulance. And yes, we can see your presentation.
All right. Well, hey, thank you, Barbara, for having us. Great info, Andrea and Orion. Appreciate you guys. My name's Todd Glasser, and I am with MedRide. We are a family-owned business that was started in January of 2018. So we're kind of a little bit over that 9-year mark. And today we operate with about 300, a little over 320 vehicles, both ambulatory and wheelchair, and we cover the entire state of Colorado, and we do approximately a little over 2,000 trips a day. MedRide is successful primarily for one reason, and that's we could not do it without our drivers. Our drivers, I think we're a little bit different than a lot of our competitors. All of our drivers are all full-time W-2 fully benefited employees. We have kind of three founding principles um, throughout our vehicles, and that is safety, compassion, and on-time performance. Our drivers offer door-to-door service, so we just don't pull up to the curb and drop people off or pick people up. We're going to walk in and kind of do a warm, friendly handoff. Each and every one of our drivers is in a MedRide uniform. You'll see them in a polo, or this summer they may have on a t-shirt, and then in the winter they'll have jackets. And then just to proceed a little bit, what Orion was saying, you'll see our vehicles scattered throughout the entire state of Colorado. They're all very well branded. They're all very well identified, again, throughout the entire state of Colorado. We have 4 different locations throughout the state. We are down in Pueblo. We have our office in Colorado Springs, and I would say our office in Colorado Springs is kind of our main hub. You'll see a lot of our phone numbers that are associated with that, and that's kind of our call center. We have about 45, 50 people all day long that are operating phone lines and booking trips and making sure that people are getting where they need to be. I reside here in Highlands Ranch. We've got our finance and a few other of our marketing team here in Highlands Ranch. And then we're also out in Grand Junction, where we have a supervisor that manages a large fleet and a large team. Our hours of operation, we operate 24 hours a day, 7 days a week. So as long as you can get a phone call in between the hours of 6 a.m. and 6 a.m. and 7 p.m. Monday through Friday, as long as you reserve a trip then, whether it's the day of or 24 hours before or 3 weeks before, as long as you can book a trip during that time, we will get you scheduled. We also operate our call center on Saturdays and Sundays between 8 a.m. and 5 p.m. MedRide technology. This is really interesting, and again, similar to our employees being full-time benefited employees, I think this is kind of something that separates us a little bit. Every one of our vehicles has Verizon Connect on board, which means the second that you get into the vehicle, you become a movie star because we are we are videotaping the entire cabin of the trip. And it's for the safety of our participants as well as the safety of our drivers. We also have technology on board that really tracks our vehicles, kind of what they're doing, how they're doing. Um, you'll see GPS tracking. We kind of have an AI behavior analysis. We have an automated traffic and safety detection, and that automatically emails our supervisor at each and every time there's a violation. So some of those violations could include speeding, um, rolling through a stop sign instead of stopping at a stop sign, lane departures if we're not using our using our blinkers, if we're tailgating. The system will also pick up cell phone detection. So based upon the driver and what how their hands are detected and their eyes are detected. Seatbelt violations, um, braking hard or accelerating too quickly will send an email. Yellow light, if we roll through a yellow light, the supervisor will get an email from that vehicle as well. And then finally, unsafe following distance. If we get too close to vehicles, the supervisors get emails as well. So you can bet there's a lot of days where I'm in a MedRide vehicle. They won't let me drive passengers, but they will allow me to drive the vehicle, and I'll get a call from the supervisor because occasionally I'll make a turn and not use my blinker. And at the end of the day, that supervisor's taking those emails and they're communicating with the drivers just to find out what's going on or just to reiterate the importance of safety. We associate ourselves in three different ways from participating from a pay standpoint, but the first is private pay. So anybody and everyone throughout the entire state of Colorado or beyond can call and book a trip. And at that time, at the end of the trip, we'll give you a quote on that trip. And if it's something that you agree to, we're going to take your credit card over the phone and collect payment up front. MedRide also does a lot of different, we do different contracts throughout the state. We have contracts with hospitals, we have contracts with rehab centers, hospice, different nursing homes throughout the state. And then finally, about 2 years ago, we tapped into the education vertical, which we are doing contracts with school districts, and we are transporting students with behavioral issues, students that are homeless, students that are coming out of a different institution. But we take them and we pick them up, and we do over 100 students a day. So we absolutely love that. I think our drivers have built relationship with these kiddos, and a lot of them, some of them have some disabilities, and it's just a comfort thing. And we have the repetition of our drivers, and we also do that with particular clients as well, where you can ask for a driver, or we can keep that same driver based upon the run that they're doing. And then, from a compliance and training, this is just a list, but it's a pretty comprehensive list of everything that one of our drivers, before they're hired, has to go through. And then some of these we have annual checkups, and you can see the list: active Colorado surrounding state driver's license. We do a criminal background check. We do an FBI fingerprint check, a national sex offender check, a state sex offender check. We do a 10-panel drug screen, which is a little bit above and beyond obviously the 7-panel. We do a motor vehicle report throughout the year, not just initially when they're hired. We do exclusion screenings. We do child abuse and neglect. We do a medical exam before they're hired on with us. And then from a acknowledgement and process standpoint, each and every one of our drivers has to approve the handbook, all the different HIPAA training, the confidentiality agreements, the healthcare compliance training, the healthcare compliance policy, culture competency training, fraud, waste, and abuse training. You can see the list goes on and on and on. But it's something that we take very serious, and each and every one of our drivers has to complete. We do our own on-the-road driver training. Each and every one of our drivers is first aid and CPR certified. And then we do some defensive training, and then there's a lot that goes into our vehicles. Some of the things that we request from, securing the wheelchair, making sure our passengers are locked in with their seat belts, just a little bit of everything. And really, that's kind of MedRide in a nutshell. But, again, just to kind of reiterate, today we're doing over 2,000 trips a day. We've recently signed some pretty large contracts that are going to come into play July 1st that we're really excited about. Can't necessarily announce those, but hopefully you'll see more and more of the MedRide vehicles out there. But if I can ever help anyone in any way, please don't hesitate to contact me.
Todd, we have a couple of questions.
Yeah.
How is unsafe information relayed to the drivers? I mean, they may not be paying attention and that didn't put on their blinker or something. Or
Yeah.
is it after the fact, or is there any kind of alert within the vehicle to remind them?
We have little, bells and whistles inside the vehicle, but at the end of the day, if there's two or three and it's just, oh, he was 5 miles over the speed limit or he didn't use a blinker. It's I think when they get into double digits. So when that number hits 10 for the day, the supervisor is going to call them before the end of their shift and say, hey, are you having a rough day? What's going on? You had 10 violations. Or you had 12 violations. So it's all based upon, the volumes and what's significant from a safety aspect.
Okay. Next question is Medicare and Medicaid participants. Do they qualify in any way for rides
They
without out of
absolutely,
pocket?
yeah, that gets a little tricky, but they absolutely do. So we do probably 1,400 trips a day for Medicaid, and this is where it comes into play a little bit. So there are 9 counties basically that surround the city of Denver. And in those 9 counties, MedRide does not perform any Medicaid trips. We do everything outside of the 9 Denver counties. So kind of Castle Rock and south, and then down to the southwest, and then out on the Eastern Plains, probably past Fort Collins. But yeah, the 9 Denver counties are controlled by a broker called IntelliRide. Now, a little bit of that is changing. As of July 1st, there's going to be a new broker, and we're excited for that. The new broker will take over the entire state of Colorado and not just the 9 counties. So they're focusing on those 9 counties first, and then they're going to expand. So we'll probably get a little bit more information as time rolls on whether we can participate in those 9 Denver counties. But as of right now, we just do everything outside. Does that make sense?
Okay. What's the name of the new company out of curiosity?
Yeah, the new company will be called MediDrives, and they are a broker based out of New York.
Oh, interesting. And so do they just arrange the rides or are they literally providing?
They will just manage. So they're going to manage
Okay,
the call center and they will ship all those trips.
great, great. And what is interesting, we have a question about the general cost, and I'm sure
You bet.
that depends on how far you're going, but
Yeah, so I want to answer the Medicare side too. So
oh, I'm sorry.
we do a lot of trips for Medicare. Medicare is arranged obviously through the insurance companies. Every insurance company utilizes a broker, and within that broker, MedRide typically has a relationship or a contract with the broker that manages all those trips. So the bottom line is, yes, we do a lot of transportation for Medicare. From a
Thank
cost
you.
standpoint, we are throughout the entire state. We utilize what's called the PUC license, the public utility license. So that's very similar to a taxi cab for our ambulatory. So we follow all those taxi cab rates, and our rates are $15 a load fee and then $2.50 a mile. But the good news is you can call our call center and you can get a quote over the phone before you agree or disagree. And you're gonna supply the address to where you're being picked up and the address to where you need to be taken. You'll tell them what time you need to be at your appointment. And we also have a software system that really breaks it down. If there's construction based upon the time of day, they can buffer how much longer it's going to take or how less it's going to take. So I strongly always tell people to call the call center and get a quote and see if it's right for you. From a wheelchair standpoint, we do $60 a load fee and $3 a mile. But again, the most important thing to do is call the call center and get a quote. And then you can
Right.
say, thank you or no, thank you.
Okay. Do we have any other questions for Todd? If not, we're going to move on to Andrea, who has lots of other information for us.
Thank you, guys.
Question, is Dr. Mack going to present?
No, I thought you might quickly mention Dr.
Yes.
Mack and the guide, please, and then
I will
talk
do
about
that.
your programs.
At one point, it said Dr. Mack would be here, so I had to be careful.
Well, you're both.
Yes, I am. Hi, everybody. I'm going to tell you first about a special program I have for Arapahoe County, in case any of you operate in Arapahoe County. So this is the program that is for Arapahoe County. Arapahoe County gave me a grant for the transportation of these people. It is for disabled or shut-in adults, generally over 60, but if you're shut-in, you can be under 60. And I've been using Meals on Wheels as kind of a determining factor that they're not leaving their homes. One day a week, we'll take them to the nearest recreation center, and we pick them up at no cost, and we bring them home afterwards. I've got 2 groups going right now. 5 recreation centers have agreed to be part of the program. And right now, Buck and Mally have their people going, and I wish I could get the other 3 going. I haven't gotten anyone interested. I've sent this flyer out through Meals on Wheels, and all of a sudden I started getting people, but only from Buck and Mally areas. Anyway, that's that. Okay. Otherwise, I am on the board of directors for the Denver Regional Council. Yeah. The Denver Regional Mobility and Access Council. That is Dr. Mack. And they provide a booklet every year and a half with all of the ride providers in the 9, actually, I think it's more than 9 now, in the 9-county metro area. Right now, the booklet has over 100 ride providers in it. Todd Glasser is one of the companies that is in the book, and they give basic information for that when you can call the provider for a ride, what it might cost, what their transportation area is. Some of them, like the Littleton Omnibus, only does its rides inside the boundaries, the proper boundaries of the city of Littleton. And the same with the Englewood BERT, which is a new name, BERT. And I'm not at all sure what it stands for, even though I have heard the definition once. But they have a specific route, and they have bus stops in Englewood, and it basically goes along Floyd in one direction and Hamden in the other, and it goes to the light rail. And if that suits you, it's a free ride. Littleton Omnibus is also a free ride. RTD helps pay for both of those systems. The booklet is generally available from, and I had the phone number right here, and I know it's 3113, but what's the first? Okay. You can get a booklet from Dr. Mack at 303-243-3113, or the whole booklet is available online and has a facility for looking up where you are, where you want to go, and giving you however many options there are to get to that location. And the website is www.drmac-co.org. So you can see the whole booklet online as well. It's a wonderful booklet. Mostly seniors who don't have access to internet get them. I go to senior resource fairs, but it's a very good booklet. Dr. Mack has local coordinating councils. Basically, they're trying to establish them, one in every county. So I am the Arapahoe County Local Coordinating Council. And my group decided to do this project with the shut-ins.
Andrea, would you give us that website again for Dr. Mack? And I'm typing it in the chat.
That's what I was just going to do. www.drmac-co.org. I imagine the co stands for Colorado.
Yes, I've got it in there. And I've got the phone number as well. You can also always go to AgeWise and connect through AgeWise Colorado.
Yes. So all of this information is definitely on the AgeWise website as well. And you can call that phone number I gave if you're not sure about the booklet. You can call that number. It's an information and assistance number. They will help you find the ride that you need. Okay.
Great.
Anything unclear? Any questions?
Does anyone have questions for Andrea?
Okay.
No, thank you. You know, you can find any of these providers on our AgeWise website. They're fabulous. They have been vetted. We've checked them out thoroughly, and they're there to help you with any of your transportation needs. Let me double check. There was one question, Todd, if you can really keep getting the same driver for medical appointments. I responded that it was my understanding you do the best you could. I doubt there is an absolute guarantee. Can you address that?
Yeah, we try to do everything we can when those requests are made. It gets a little tricky. The longer in advance you can give us, it gets a little simpler. So keep that in mind, but it does get a little tricky the day before or the day of.
I would imagine someone like going for dialysis treatment that has regular appointments, something like that could be really established.
Yes, ma'am. Yep, that's
Good.
a great point.
Good. Okay, well, even though we started late, I think we're going to end just fine. Does anyone else have any questions before we end the day? I'm just putting this back up there so you can write it down. Again, this is being recorded. It'll be on our website probably by the end of next week. And you can find any of these providers on our website if you have trouble finding them directly. I really want to thank all of our providers. I appreciate your time. And to everyone, I appreciate your patience in the struggles we had getting this started this morning. Thank you. And I hope you all have a great afternoon. And with that, I'll say goodbye.